In Washington, retired caregiver Jane Weaver is walking the halls of Congress pressing lawmakers to protect healthcare funding as the U.S. government shutdown drags into its third week.
I know we have to do something about the Affordable Care Act. There is no way that people are going to be able to afford the premiums for that Affordable Care Act. And when they can't afford it and they drop it, and then they're still going to need health care, they go in under uninsured, every person is going to feel a hurt to their insurance. Because if you have insurance, it's going to go up higher. So there's not a person it's not going to affect. Maybe today they can say, oh, this doesn't bother me, this is not something I have to worry about. Wrong.
Weaver, who represents more than 10,000 retirees, says proposed cuts to Medicaid and the lapse of federal subsidies could leave millions without coverage.
I was here in May for the hearings for Medicaid, and I left here thinking to myself, do they not know what they're doing, or do they not care? And the longer it went, I believe they don't care. I went back to my people and said, I wish they could have been with me to see the attitude and to see that they weren't caring about what they were doing. If they would stop and think about the effect on the people they represent, they would have never passed the cuts to Medicaid.
She and other advocates say older Americans will take their fight to the polls if Washington fails to act.
I represent over 10,000 retirees. That's a lot of medical problems. The older you get, they're dealing with medical problems every day. The big joke among my friends is more doctor's appointments than anything else. But I'm sure whatever it takes, we'll get them to the polls. We have to each one take turns taking people to the polls.
Across the Capitol, furloughed Food and Drug Administration employee Anthony Lee is one of thousands caught in the shutdown's fallout.
The Food and Drug Administration, the FDA, is unique because some of our staff are not affected by shutdowns due to user fees that we collect, but then a significant number are affected by shutdowns. So that kind of anxiety of people preparing for, am I going to be shut down? Am I going to be without pay? And sadly, a great portion of our food safety work and the experts that do food safety work fall in the area where there's no user fees and where they are furloughed, like myself.
Lee says the missed paychecks are forcing painful family decisions.
So there are people who are going to work today right now that are looking at things that protect the food that we eat or making sure drugs and devices are safe and effective. And some of them are not getting paid for the work that they're doing. They deserve to get paid just as much as our military for the public service that they're doing.
He calls withholding pay lawlessness, noting that federal workers are guaranteed pay back once the shutdown ends.
Me, as a father of two sons who are both in college, I've had to have a conversation with my son about whether or not I'll have money to help him pay his tuition costs. I mean, families don't have thousands of dollars just to pay tuition, so like my family, many are on a payment plan for college tuition. So it is beginning to have impacts on our finances.
In Philadelphia, mental health technician Charlotte James says hospital systems are stretched to the limit as funding stalls.
To not pay federal employees after a shutdown. The current president, who was the former president then, signed the actual law that says federal employees are guaranteed pay if there's a government shutdown, because it's not their fault that Congress can't come to a resolution and solve these kind of problems that stop our budgets from going forward.
James says closures of long-term outpatient facilities are worsening the crisis. She continues to lobby lawmakers herself.
It taxes the system. It puts the system in an overload. Some nights you can have 5 patients waiting to be seen to come to an inpatient. Some nights you can have an overload of 28 patients where everybody's just sitting because there's not that many psychiatric beds in this region. From July to now, there were 3 long-term facilities that did outpatient care, and they've done away with them. And one of them was a 30-plus year facility. It's gone. I was there personally advocating for what I know I feel as though is right, to get the go to the congressman's office, talk to their staffers about how does it really impacts us. So it's not a guessing game of how it impacts us, so they can know how it impacts us. I want to take care of the people that we take care of and continue and be compensated for it. It's not about the money, it's about the wellness, the holistic wellness of it. Keeping my community well, because I live in this community.
As the shutdown over healthcare funding enters day 13, Lee and others warned the standoff could ripple far beyond the Affordable Care Act. Weaver insists healthcare should rise above partisanship.
Close to 90% of our members understand why this shutdown is happening, that the fight's over healthcare costs, over increasing costs to a level that is unsustainable for working families, or even people being kicked off of their healthcare. And many feel that it won't stop with just recipients of the Affordable Care Act. It'll then be federal employees and then working families across America whose healthcare costs rise to a level that no one can afford.
I hope Congress comes through and lifts a doomy cloud up off of us, because I'm really anxious about this, because this really impacts my livelihood, how I'm paid, how I go to work, my co-workers, because I represent not just myself, but a whole group of people.
Medical care is not a partisan issue. It's nonpartisan. It's life or death issue, and it should be dealt with that way.
As talks continue in Washington, millions remain caught between political gridlock and growing economic anxiety.